His has been a loud silence since reports of public coffers being drained came to the fore. The Health Principal Secretary, who doubles up as the accounting officer, now releasing a breakdown of expenditure in the ministry. Muragori puts the figure subject to the interim audit report at 3.1 billion, disputing the 5.2 billion shillings in the leaked interim audit report. The statement from the PS claims, quote, the auditor has not identified any fraud or misappropriation of funds, end quote. The ministry further states it takes exception with the audit report, saying the head of the internal audit unit did not share the report with the management, a fact that should have enabled it to address the issues raised. The report had raised the red flag on over-expenditure. In the ministry's response, however, an instance of some 302 million shillings were channeled to the Free Maternity Fund erroneously that should have been for the Global Fund TB Round 5 KMTC Director and Health Sector Support Project. It also disputes an over-expenditure of 413 million shillings in the purchase of portable clinics, which it says its records show was 11.9 million shillings instead. And while the report indicated that some payments were inconsistent to the purposes for which they were allocated, with an instance of 411 million shillings for construction of buildings, the PS claims all payments were compliant. It is a question of accountability in efforts to unravel the mystery of the missing Afia House billions that has now taken a political turn. But calls to have a heads roll now continue to intensify. It is a scandal that has seen the Ekuru Aukot-led Third Way Alliance call for protests, adding their voice to the growing political outrage.
When money for medicine is stolen, a leader should be able to see that as murder being committed on the innocent and the sick in hospitals. Any reasonable leader should fight corruption, which kills poor and sick Kenyans by whatever means possible.
Jackie Maribe, Monday Special.